A trip to the emergency room can instantly change your life, not just medically, but financially. According to a June 2022 study by the Kaiser Family Foundation, 41% of adults currently have some debt caused by medical bills.
And that same study found 30% of Americans who currently do not have healthcare debt would be unable to pay an unexpected $500 medical bill. Consumer investigator Rachel DePompa speaks with experts helping those struggling under the weight of medical debt.
911, what's your emergency?
1350 East 49th Street.
Transport is on the way.
She shows up in life's critical moments.
Code Blue, room 305. All nurses to the nurses station.
People's lives get turned upside down in an instant. And a lot of folks think it's not going to happen to them.
But when it does, Rita Krentz is saving lives. She's a critical care flight paramedic in Virginia, and she knows better than most. An unexpected trip to the hospital can leave a person with crushing financial debt.
An ambulance is going to send a bill, the emergency department sends a bill, the radiologist who reads your CTs and your x-rays is probably going to send a bill.
Nationally, 14% of all Americans have medical debt in collections, according to the Urban Institute, a nonprofit research organization.
And that number only includes the medical debt in collections, not all of the debt owed to providers in this country. And this map from the Urban Institute, it shows that debt in collections. It's the highest among people living in the South, usually in lower income communities.
As of August of 2021, the typical amount of medical debt in collections was $700. Rochelle Jordan is a single mother of 4 in Arizona. She spoke to us over a quick lunch break at her fast food job, the only time she could spare.
I don't remember what was wrong with me, but I know that I got a big medical bill from the hospital.
After falling dizzy on her way to work, a friend called a paramedic. And for 9 years, Jordan said after the ambulance ride and trip to the ER, she had thousands of dollars in medical bills hanging over her head.
I need good credit so that way my kids and myself can have a place to stay.
It's the #1 cause of bankruptcy across the country. It is something that burdens everyday Americans all the time. Nobody is really immune to it.
Allison Sesso is the executive director of RIP Medical Debt, a nonprofit that pays off medical debt for families across the country. It uses donations to buy large bundles of old debt from hospitals and collection agencies. The nonprofit randomly selects families in desperate need, those making less than 2 times the federal poverty level, which is why when help came from RIP Medical Debt, Rochelle Jordan was stunned.
It's like a present, like Christmas. You don't know what it is until you open it up.
A letter telling her she no longer has an obligation to pay this debt to anyone. It's gone.
People, feel a real mental burden when they have a debt. Even if it's $1,000, it's something that physically hurts them because it's weighing on them.
In just 9 years, the organization's relieved $9.5 billion in medical debt. Chris Van Haren worked for 2 decades as a pharmacist in Madison, Wisconsin. She is now a medical advocate, helping families understand their insurance and file appeals.
Are we in a medical debt crisis in this country?
Absolutely. When GoFundMe is the main way that people pay for their medical bills, we know we're in trouble.
Van Haren suggests take the time to learn your insurance plan and the hospitals in your network. Then make a separate list of out-of-network hospitals so when an emergency happens, you know your copays, the money you're expected to pay up front.
Open any letters that you find inside your mailbox from a medical facility. Those bills can end up in collections quickly. 58% of all the bills in collections are medical.
If you have any questions about your bill or something doesn't look right, call the billing department or connect with a patient advocate who can help you through the process. There's no way to apply for help from an organization like RIP Medical Debt. Debt is chosen at random. Rochelle Jordan knows she was one of the lucky ones.
This is a smile of a person that's happy to be cleared off that debt.
In April of 2023, the White House unveiled new measures to help alleviate medical debt and its impact on Americans' credit. Also, the three major credit bureaus announced that they would stop reporting medical collection debt below $500.
Medical bills can be overwhelming, and sometimes you just need someone in your corner to help. We go back to consumer investigator Rachel DePompa, who walks us through how to find someone to speak up for you.
Patient advocates fight for you when dealing with doctors, medical professionals, and insurance companies. They'll look at your bills and help you understand your insurance. Some charge, some offer the service pro bono. It's one of the fastest growing fields, expected to produce 51,000 jobs over the next 10 years, according to job search site Zappia. Take a look at this map. The darker purple are the places with the most advocates. So how do you find one? One place you can check, gnanow.org. It's the Greater National Advocate Organization. It gives you access to a network of independent patient advocates. Just click this tab, the green search button. You can search for a specific type of health advocate. For example, you could put in billing and insurance and then your zip code and your city to find a person near you. You'll get a list of people with a photo, a phone number, and an email address. Chris Van Haren has her own advocacy group based in Wisconsin, but she also helps people across the country.
So we spend the time on the phone. We spend the time writing the letters. We spend the time gathering all of the necessary documents and addressing them so that you can focus on your health.
You will likely pay a fee by the hour for a patient advocate. Prices can vary state by state, and they could save you several $100s, even several thousand on medical bills. There are some national organizations that provide this service for free.